this lecture, we will discuss about the larynx, commonly known as the voice box. The larynx derives its name from the Greek word larynges, meaning the upper windpipe. Regarding the functions of the larynx, two of the functions of the larynx, they are very well known that it is a part of the conducting airways. It will conduct air from the upper respiratory to the lower respiratory passages. Moreover, larynx is involved in production of sound, that is the phonation. But phonation is a secondary function of the larynx. The primary function of the larynx is the protection of lower respiratory passages. That is, larynx will allow only air to enter into the lower respiratory passages, and if any other foreign substance tries to enter into the cavity of the larynx, the sensitive mucosa of the larynx will immediately start a cough reflex and this foreign body will be expelled out. So functions of the larynx, they can be enumerated as the primary function is the protection, but other functions, they are respiration, phonation, and also the larynx by its upward and downward movement helps in deglutition. And clinically, larynx is involved in a number of diseases, like the foreign body may get accidentally stuck into the larynx, and this will require immediate removal, which is an emergency procedure. Nodules may form along the vocal cords in singers or teachers who use their vocal cords excessively. Moreover, paralysis of the vocal cords can occur during the various thyroid surgeries. So in this lecture, we will discuss about the gross anatomy of the larynx and we will try to correlate it clinically. First, about the location of the larynx. In this diagram, we have shown the larynx by the yellow color, and we can see the cartilages of the larynx, which are shown by the blue color, the epiglottic cartilage. Second is this thyroid cartilage, and third is the cricoid cartilage. And we can see that larynx will extend from the root of the tongue till the beginning of the trachea or till lower border of the cricoid cartilage. And if we consider the vertebral levels, it will extend from the third cervical to the sixth cervical vertebra. So extent of larynx is from the root of the tongue till the beginning of the trachea. And if we see the dimensions of the larynx, the length and the anteroposterior diameter of the larynx, it is more in males as compared to the females. And till the puberty, the size of the male and the female larynx, it is same, but at the time of puberty, the male larynx will grow rapidly and it will become double its size. So length of the male larynx is about 44 millimeters, but it is only 36 millimeter in females. Now we will discuss the gross anatomy of the larynx under the following headings. First, about its skeleton, then cavity, then about the vascular and the nerve supply, and lastly its applied anatomy. First, we will discuss the skeleton of the larynx. The larynx, it is made up of a number of cartilages, and these cartilages, they are joined to each other by various joints, ligaments and membranes, and also the movement of the cartilages, it is done by a number of muscles. So skeleton will be discussed under four headings: the cartilages, joints, ligaments and membranes, and muscle. First, about the cartilages of the larynx. There are total 9 cartilages in the larynx, out of which 3 are paired and 3 are unpaired. First, about the unpaired cartilages. The unpaired cartilage of the larynx are this large shield-like thyroid cartilage. The second is this ring-shaped complete cartilage, which is the cricoid cartilage. And third unpaired cartilage is this leaf-shaped cartilage attached to the posterior surface of the thyroid cartilage. And unpaired cartilages of the larynx, they are the ARYTENOID, corniculate, and the cuneiform cartilages. So these three cartilages, they are under the paired variety. Now some of the cartilages of the larynx, they are of hyaline variety and some are the elastic variety. So hyaline cartilages of the larynx, they are the thyroid, cricoid, and part of the ARYTENOID cartilage. And the corniculate, cuneiform, and epiglottic, they are the elastic variety of the cartilage. And in the ARYTENOID cartilage, two parts of the cartilage, that is, one is this focal process and second is this apex of the ARYTENOID cartilage, They are in the elastic variety, but rest of the arytenoid cartilage, it is of the hyaline variety. So we will study the cartilages, total 9 cartilages in the larynx. 3 are paired and 3 are unpaired. And unpaired variety, it is the thyroid, cricoid and epiglottic, while the paired, they are arytenoid, corniculate and the cuneiform cartilage. First, we will study about the thyroid cartilage. The thyroid cartilage, it is the largest cartilage of the larynx, and the word thyroid itself means shield-like. So this cartilage will cover the larynx from its anterior side like a shield. And the thyroid cartilage, it consists of two laminas. We can see this right and the left lamina. And the two laminas, they are joined along their anterior border to form a laryngeal prominence. While their posterior border, they are free, and the posterior borders, they are prolonged upward and downward as the superior horn or superior cornua and inferior horn or inferior cornua. And along the anterior border where the two laminas they join, they will make an angle of 90 to 120 degree. This angle will be 90 degree in males and 120 degree in females. And this acute angle of 90 degree in males is responsible for a prominent laryngeal prominence or Adam's apple in males. Now, along the upper and the lower border of the lamina of the thyroid cartilages, a number of ligaments and membranes they are attached, which we will study in the next diagram. So here we can see the ligaments and membranes along the laminas of the thyroid cartilage. So along the upper border of the thyroid cartilage, a membrane, thyroid membrane, attaches the thyroid cartilage to the superior border of the body of the hyoid bone and the greater coronu of the hyoid bone. And this thyroid membrane, if we see in the midline, it is thickened to form a median thyroid ligament here, and also laterally or along the posterior border, it is thickened to form another ligament, that is the lateral thyroid ligament. And this lateral thyroid ligament is attached inferiorly to the superior coronu of the thyroid cartilage and superiorly up to the greater coronu of the hyoid bone. And also this thyroid membrane is having an aperture for the internal laryngeal nerve and superior laryngeal vessels. So along the upper border of the thyroid cartilage, a thyroid membrane is attached, which will attach the thyroid cartilage to the hyoid bone. And now along the lower border of the thyroid cartilage in the midline, a ligament, median cricothyroid ligament, will attach the thyroid cartilage to the upper border of the cricoid cartilage. So these are the two ligaments which will attach the thyroid cartilage to the hyoid bone and the cricoid cartilage. Now if we see along the outer surface of the lamina of the thyroid cartilage, a prominent ridge is present, that is the oblique line of the thyroid cartilage. To this oblique line and also along the posterior free border of the thyroid cartilage, a number of muscles they are attached, and these muscles are the strap muscles of the neck and the muscles of the pharynx, as we see in the next diagram. So in this diagram, we can see the oblique line of the thyroid cartilage, and to this oblique line, three muscles are attached. First is the thyroid muscle, second is the sternothyroid muscle, and third muscle is of the pharynx, which is shown by this black dotted line. And this is inferior constrictor muscle of the pharynx. And in between the sternothyroid and inferior constrictor muscle, the apex of the thyroid gland will be related to the oblique line, as we see in this second diagram, where we can see the apex of the thyroid gland reaching up to the oblique line of the thyroid cartilage. So these are the relations along the oblique line. Now along the posterior border of the thyroid cartilage, three pharyngeal muscles they are attached: palatopharyngeus, salpingopharyngeus and the stylopharyngeus muscle. These three muscles of the pharynx, they are responsible for the elevation of the larynx during the process of deglutition. Along the inferior border of the thyroid cartilage, a muscle, cricothyroid muscle, will be attaching the cartilage to the cricoid cartilage. So on the external surface of the lamina, three muscles on the oblique line, thyroid, sternothyroid, and inferior constrictor muscle of the pharynx is attached. And along the posterior border, three pharyngeal muscles are attached. And along the inferior border, the cricothyroid muscle is attached. Now, on the inner surface of the thyroid cartilage, various ligaments they are attached, and these ligaments are, as we see in this cut section of the thyroid cartilage, inner surface of the thyroid cartilage can be seen, and to this inner surface another cartilage of the larynx, that is the epiglottis, is attached by a thyroepiglottic ligament. Two other ligaments which are attached, the upper one is this vestibular ligament or the false vocal cord, and the lower one is the vocal ligament or the true vocal cord. Now these two ligaments, vestibular and the vocal ligament, they will attach the thyroid cartilage to the arytenoid cartilage behind. And some muscles they are also attached along with these ligaments, which we will study in the next part of the lecture. So here we can see in this diagram the muscles along the inner surface of the thyroid cartilage. So the internal surface or inner surface of the thyroid cartilage will have three ligaments: thyroepiglottic, vestibular, and the vocal ligaments. So this is about the thyroid cartilage, which is having two laminas and is acting as a shield covering the larynx from the anterior side. And the two lamina of the thyroid cartilage, they are joined along the anterior border by laryngeal prominence, and their posterior borders, they are free and they are prolonged upward and downward as superior and inferior cornua. To the upper border of the cartilage, the thyroid membrane is attached, and to the lower border, cricothyroid ligament is attached. And to the oblique line and posterior border of the thyroid cartilage, various strap muscles and the pharyngeal muscles are attached. The next cartilage, it is the cricoid cartilage. The cricoid cartilage is a complete ring-shaped cartilage. Complete in the sense this is the only cartilage which will completely encircle the lumen of the larynx. The cricoid cartilage is having a narrow anterior part, that is the arch of the cartilage, and a posterior broad part, that is the lamina of the cartilage. First we will study about the anterior narrow part, that is the arch of the cricoid cartilage. Now, the arch of the cricoid cartilage, it is connected in the midline to the thyroid cartilage by a median cricothyroid ligament. On rest of the arch, it is having an outer surface, and to this outer surface of the cricoid cartilage, two muscles they are attached. One is this cricothyroid muscle, and second is the lateral cricoarytenoid muscles. So these two muscles, they will join the cricoid cartilage superiorly to the thyroid cartilage as well as posteriorly to the arytenoid cartilage. And on the outer surface, we can also see a facet on the cricoid cartilage. This is for articulation with the inferior cornua of the thyroid cartilage. Now, along the superior border of the arch of the cricoid cartilage, a membrane, cricovocal membrane, is attached. And if we see the upper border of the cricovocal membrane, this is thickened to form a vocal ligament, which is the true vocal cord. And this vocal ligament will be attached anteriorly to the thyroid cartilage and posteriorly to the vocal process of the arytenoid cartilage. So these are the attachments along the arch of the cricoid cartilage. Anteriorly, there is a median cricothyroid ligament, and on the outer surface, cricothyroid and lateral cricoarytenoid muscles are present. And along the upper border of the arch, a cricovocal membrane is attaching the cricoid cartilage to the thyroid as well as the arytenoid cartilage. The cricoid cartilage is said to be the foundation stone of the larynx, as this cartilage is attached both to the thyroid as well as the arytenoid cartilage, and it can take participation in the all the movements of the larynx. Now about the posterior broad part of the cartilage, that is the lamina of the cricoid cartilage. As we see in this second diagram, the posterior surface of lamina is seen, and in the midline of the posterior surface there is a prominent ridge, and to this ridge all the longitudinal muscles of the esophagus, they will be attached. And on either side of the ridge there are two depressions, and these depressions, they are for the attachments of the posterior cricoarytenoid muscles. And along the upper surface or superior surface of the lamina of the cricoid cartilage, we can see it is attaching to the another cartilage of the larynx, and these are the arytenoid cartilage. So lamina of the cricoid cartilage will give attachment to the esophageal muscles and to the posterior cricoarytenoid muscle, and it will also articulate with the arytenoid cartilage. So this is about the cricoid cartilage, which is having a narrow anterior part arch and a posterior part broad part, that is the lamina of the cricoid cartilage. Now about the third cartilage, that is the arytenoid cartilage. The arytenoid cartilages, they are the paired cartilages of the larynx, and shape of the arytenoid cartilage is in the form of a triangular pyramid, and it is having a narrow apex and a broad base. At the broad base, the arytenoid cartilage will articulate with the cricoid cartilage. And arytenoid cartilage, it is having three surfaces. This one is the outer anterolateral surface, one is this posterior surface, and third is the medial surface. And medial surface of the two arytenoid cartilages, they will face each other. And the apex of the arytenoid cartilage, it will articulate with the other cartilage, that is the corniculate cartilage, while the broad base of the arytenoid cartilage, it is prolonged anteriorly as the vocal process and posteriorly as the muscular process. And to this anterior vocal process, a ligament is attached, that is the vocal ligament or the true vocal cord. As we see in this third diagram, we have already studied a cricovocal membrane from the cricoid cartilage, and the upper part of this cricovocal membrane is thickened to form the vocal ligament, and this ligament will be attached to this vocal process and anteriorly to the posterior surface of the thyroid cartilage. To the muscular process of the arytenoid cartilage, the cricoarytenoid muscles, they are attached. And to the anterolateral surface in the upper part, another ligament is attached, that is the vestibular ligament or the false vocal cord. As we see in this third diagram, we can see the vestibular ligament from posterior surface of thyroid cartilage to the arytenoid cartilage. So these two ligaments, one is the vestibular ligament and second is the vocal ligament. They will connect the thyroid cartilage posteriorly to the arytenoid cartilage. And now the relation of the arytenoid cartilage to the cricoid cartilage is such that it can actually rotate over the cricoid cartilage. As we see in this diagram, the arytenoid cartilage, it can either rotate medially or laterally. The medial movement of two arytenoid cartilage will bring their vocal processes close to each other, and this will result in bringing close of the vocal ligaments, while lateral rotation will move the vocal processes away from each other, and that will result in diversion of the two vocal ligaments. So this is about the triangular cartilage of the larynx, that are the arytenoid cartilage. And most of the part of the arytenoid cartilage, it is hyaline in nature, but this vocal process and the apex of the arytenoid cartilage, it is elastic in nature and it will never ossify. The two other small unpaired cartilages of the larynx, they are the corniculate cartilage and cuneiform cartilage. The corniculate cartilage, it will articulate with the arytenoid cartilage, while the cuneiform cartilage, which is a small cartilage, it is present in the epiglottic fold. Now, so three paired cartilages, the arytenoid, corniculate, and the cuneiform. The next cartilage which we are studying, it is the epiglottis. So in this diagram, we can see this epiglottis, which is a leaf-shaped cartilage, and this epiglottic cartilage, it is attached at its lower end to the posterior surface of the thyroid cartilage by a thyroepiglottic ligament. The epiglottic cartilage, it is having an anterior surface and a posterior surface. The posterior surface of the cartilage, it will face towards the laryngeal cavity, and attachments along the anterior surface are the epiglottis, it is attached anteriorly to the hyoid bone by this hyoepiglottic ligament, and near the upper border on the lateral margins, the epiglottis, it is also attached to the tongue by the glossoepiglottic ligament, as we see in the second diagram, third diagram. So here we can see the posterior one third of the tongue, and this is the epiglottis, and epiglottis is attached to the root of the tongue by a median glossoepiglottic ligament in the center and two lateral glossoepiglottic ligament. And in between the median and the lateral glossoepiglottic ligament, a depression is formed, and this is named as the vallicula. So anterior surface of the epiglottis, it is attached to the hyoid bone by hyoepiglottic ligament, and it is also attached along its anterior part to the tongue by the median and the lateral glossoepiglottic ligaments. Now the posterior surface of the epiglottis, as we see in this first diagram, this will face towards the laryngeal cavity, and this part of the lower part of the posterior surface, it is in fact covered over by the respiratory epithelium, but rest of the epiglottis, it is covered over by the stratified squamous non-keratinized epithelium. The posterior surface of the epiglottis, it will also show numerous mucus glands on its surface. The two free lateral borders of the epiglottic cartilage, as we see in the third diagram, they are attached to the apex of the arytenoid cartilage by the aryepiglottic folds. So the epiglottis, it is attached anteriorly to the hyoid bone, as we see in first diagram, by hyoepiglottic ligament, and to the tongue by glossoepiglottic ligament, but posteriorly it is attached to the arytenoid cartilage by the aryepiglottic ligaments. And during the movements of swallowing, the epiglottis, it will curve posteriorly so that the food bolus will move along its anterior surface, and it will close this laryngeal inlet. So this is about the cartilages of the larynx, in which three are the unpaired cartilage, which are the large shield-like thyroid cartilage, a complete ring-like cricoid cartilage, and third unpaired is this epiglottis, a leaf-shaped cartilage. While the three paired cartilage, as we see in the third diagram, they are the arytenoid, corniculates, and the cuneiform cartilage. And two small cartilage, they may be present in the thyroid membrane, they are the cartilagotriticea. Now these cartilages of the larynx, they are joined to each other by various joints. As we see in the first diagram, the thyroid cartilage is joined to the cricoid cartilage by a cricothyroid joint. The second joint is possible between the cricoid and the arytenoid cartilage, the cricoarytenoid joint, as we see in this second diagram. And third joint is between the arytenoid and the corniculate cartilage, as seen in the third diagram, arytenocorniculate joint. So three joints in the cartilages of the larynx. First is the cricothyroid, second is cricoarytenoid, and third one is the arytenocorniculate joint. First we will study about the cricothyroid joint. Now, this cricothyroid joint is present between the inferior cornu of the thyroid cartilage and outer surface of the cricoid cartilage. Now, the movement which is possible around this plain synovial cricothyroid joint is the rotation around the transverse axis. As we see in this second diagram, the transverse axis of this cricothyroid joint will pass through the both the cricothyroid joint of the cartilages, and this movement of rotation will bring the tilt will tilt the thyroid cartilage towards the cricoid cartilage, and this will actually decrease the distance between the thyroid and the cricoid cartilage. And this movement of the thyroid cartilage towards the cricoid cartilage is actually to increase the tension in the vocal cord, as we see in this part of the diagram, where we can see in this purple color the actual length of the vocal cord, and after movement of the cricothyroid joint, we can see this dotted diagram of the vocal cord, which has actually increased in length, and that has increased the tension in the vocal cords. So cricothyroid joint, which is a plain synovial joint, it can rotate around a transverse axis and can increase the tension in the vocal cord. Second joint is the cricoarytenoid joint, which is also a synovial variety of the joint. And movement which are possible along the cricoarytenoid joint, they are the rotation around a vertical axis and also a gliding. First, the rotation around the vertical axis of the cricoarytenoid joint can cause the movement of the vocal and the muscular processes of the arytenoid cartilage. The medial movement around the vertical axis will bring the vocal processes close to each other, while the lateral movement of the arytenoid cartilage will cause the movement of the vocal processes away from each other. So this rotation of the cricoarytenoid joint will bring the two vocal cords close to each other, that is the adduction of the vocal cords, or it will move the two vocal cords away from each other, that is the abduction of the vocal cords. Second movement which is possible is the gliding between the two arytenoid joint, and this gliding will bring the two arytenoid cartilages close to each other. So this is the cricoarytenoid joint which can rotate along a vertical axis and also glide around, which can bring the two arytenoid cartilage close to each other. The third joint in the cartilages is present between the arytenoid and the corniculate joint, corniculate cartilage. This is also a synovial variety of the joint. So three joints in the cartilages of the larynx are present: cricothyroid, cricoarytenoid, and the arytenocorniculate joints, and all are the synovial variety of the joints.